My name is Peter O'Grady. I'm a doctor. I work in the health service, and I'm advocating a no vote for many reasons. Health is a particular issue that is in the Lisbon Treaty. I think the first thing to say is that we're not getting any information really to tell us that health is in the Lisbon Treaty. A vital article that people can easily look up is Article 188, which says of the Lisbon Treaty, which says that health can now be traded internationally, and the veto which Ireland has will now be watered down. We will now have to prove that if somebody wants to privatise in Ireland to buy and sell services internationally to multinational corporations like the fraud-ridden Triad Corporation or many of the other corporations now targeting Ireland, we will have to prove that there will be a serious disruption to national organisation of health services in order to resist such a treaty. That power is now being lost to us. So health, education, social services, transport, energy, a whole range of public services, including healthcare, will now be available for buying and selling. The key issue for Ireland is that our government is already privatising our health services. When Fianna Fáil came to power in 1997, we had one for-profit hospital in Ireland, in the Blackrock Clinic. Following the 2002 Finance Act, brought in much like the Lisbon Treaty with no announcement that it would adversely affect healthcare or privatise it. Since the 2002 Finance Act, incidentally brought in by the EU Commissioner for Internal Market, Charlie McCreevy, we now have 7 for-profit hospitals and another 8 are planned for a total of 15 in the immediate future. So to oppose the Lisbon Treaty, people have been saying just because you oppose government policy, you shouldn't oppose the Lisbon Treaty. The Lisbon Treaty will make legitimate and will make legal what the government are already doing. If you oppose the government in their privatising of healthcare, which has caused chaos in the HSE, you should vote no to the Lisbon Treaty. The HSE is already run by business interests. The HSE board has bank managers, the head of Microsoft Europe, it has the head of a medical equipment company, a right-wing economist and so on. Business interests are already causing chaos in the Irish health services. What the Lisbon Treaty will do is to make sure that that is made legal and legitimate and give the government another reason not to reverse any of these policies. There is a clause in the Lisbon Treaty which says we must upgrade military spending. We must upgrade our military services on an ongoing basis. We would ask that instead we have a clause in a new treaty or any other form of European legislation which says we must upgrade our public services, our health service, our education service. The question and the choice for people is whether or not we back unelected officials in Europe to support the privatisation of our public services, or whether we back the real citizens of Europe who in France and Holland have already rejected this treaty in its constitution form. Do we back the people of Europe, or will we allow the elites to go on making decisions about privatising our health and public services and spending more money on militarism and war? This is the choice facing us. I would argue very strongly, please vote no.